Hello dear students, how are you all? I hope everyone's good. Previously, we have covered mandibular nerve block and its variations. I hope you guys have gotten to the concept. Today we are going to learn about mental nerve block and incisive nerve block and the differences between both. Usually the basic steps which are general and common to all local anesthetic injections are the same, like taking a sterile needle, checking the flow of the needle and warming the cartridge, positioning the patient, dry the tissue, and applying topical antiseptic and anesthetic, keeping the syringe out of the sight of the patient, and retracting the tissue while establishing a firm hand rest, and then needle insertion is attempted. All these steps are general and common to all the local anesthetic injections. The main difference exists in the indications, the techniques, the nerves and the anatomy, and the areas that are anesthetized by these two types of nerve blocks. Starting with the mental nerve block, it is used for soft tissue procedures in the region anterior to the premolars. For the mental nerve block, after positioning the patient, usually supine or semi-supine, ask the patient to partially close the mouth for better access and then locate the mental foramen with the help of the finger palpation, starting in the mucobuccal fold adjacent to the first premolar and move it slowly anteriorly. You will feel the concavity. The clinical landmarks to locate mental foramen are premolars and the adjacent mucobuccal fold. Then retract the lower lip and buccal soft tissue and insert the 25 or 27 gauge needle for about 5 to 6 mm with the bevel of the needle towards the bone. As usual, aspirate in two planes and then inject 1/3 of the cartridge for about 20 seconds. The tissue usually balloons out. In that case, withdraw the needle and make it safe, then wait for a few minutes for the area to get anesthetized. The anatomy of the mental nerve is the terminal branch of the inferior alveolar nerve exiting the mental foramen near the apices of the mandibular premolars, usually the second premolar, and also it can exit between the first and the second premolar. The nerves that are anesthetized by the mental nerve block is mental nerve, and the areas that this nerve supply are buccal mucosa anterior to the mental foramen up to the midline and skin of the lower lip and chin. Now the incisive nerve block. There are many similarities between mental and incisive nerve block. Incisive nerve block is used for dental procedures anterior to the mental foramen. The technique of incisive nerve block is the same as mental nerve block. The only difference exists when after injecting we have to apply pressure at the mental foramen site for about 2 to 3 minutes. This application of pressure is used to ensure the diffusion of local anesthetic solution inside the mental foramen and subsequently anesthetizing the incisive nerve fibers. The incisive nerve is also a terminal branch of the inferior alveolar nerve. It travels in the incisive canal and providing the sensory innervation to the teeth anterior to the mental foramen. The nerves that are anesthetized with the incisive nerve block are the mental nerve and incisive nerve, and the areas that are supplied by these nerves are buccal mucosa from mental foramen up to the midline, lower lip and skin of the chin, pulpal nerve fibers to the premolars, canine and incisors. The lingual side of these teeth does not anesthetize with this nerve block. For the lingual side, you have to infiltrate separately on the lingual side. The complications associated with the mental nerve block and the incisive nerve block are very rare, but to mention, they are hematoma during the injecting of the local anesthetic solution and paresthesia of the lip or chin due to the trauma to the mental nerve during the injection. That's it for today's session. Don't forget to like and subscribe to the dental class and take care of yourself. Bye bye.